This is a 6-dowel tensegrity model. Tensegrity can be defined as a three-dimensional structure which has components of tension and compression. When you think of posture, you think of the bones as the structure. But if you didn't have the connective tissues, the bones would not have a structure, and then they would cease to exist. They'd be on the floor. So, for example, in the spine of the body, it's holding you up. But it's not just the spine that's holding you up. It's the erector spinae that's holding it all up together. So it reinforces the structure and holds you up, as in your posture. Your posture is using all muscles all at once to keep you upright against gravity, to counteract the pull of gravity. Without these connective tissues, we wouldn't be able to hold ourselves up. When relating the tensegrity model to movement, it's easy to see that the contraction of the muscles affects the skeleton, or moves the skeleton. So when we contract a muscle, which I'm contracting the bicep, you're moving the skeleton. So in order to have movement, we need to have contractions within the body. I'm about to perform some movement patterns. For the glenohumeral joint, performing shoulder abduction and adduction, a jumping jack would be in the frontal plane and the sagittal axis. For the lumbar spine, for lateral flexion, would be a kettlebell lateral flexion, which occurs in the sagittal plane, coronal plane and sagittal axis. For the shoulder girdle, for protraction and retraction, it would be a scapular push-up, which occurs in the transverse plane and the vertical axis. For knee flexion, you could be kicking a soccer ball for flexion, and extension, which occurs in the sagittal plane and the frontal axis. For hip and medial lateral rotation, the tree pose in yoga would be lateral rotation. For medial rotation, it would be the goddess pose, which occurs in the sagittal plane and the vertical axis.